And good afternoon, everyone. Thanks for joining us on this Thursday. This afternoon, Mayor Demings will briefly share some details of our personnel deployment as it relates to Hurricane Laura, the latest information on COVID-19 testing numbers, of course, information on CARES Act funding for small businesses, eviction diversion, and other topics as well. And from the Florida Department of Health in Orange County, Dr. Alpino is here with latest details on the virus and its impact here in Orange County, statistics, numbers, and information for the weekend. We begin with Mayor Demings. Mayor?
All right, good afternoon to all of you. And there's no question that today, before we get into our COVID-19 update, we'll talk briefly about the various weather phenomena that we're experiencing. Of course, we now know that Hurricane Laura impacted our Gulf Coast states and in particular the southwest coast of Louisiana. I had the privilege yesterday of working with our Central Florida Region Task Force 4 that was deployed into the Louisiana area. And we had a contingency of Orange County firefighters that deployed with that unit. Before I came down today, I had the opportunity to speak with our fire chief, Chief Jim Fitzgerald, who had been in communication with our team of individuals who are on the ground in Louisiana. And our team, they're safe. I want you to know that, but they are fully engaged in responding to the issues there with the emergencies associated with the hurricane. From the conversation with Chief Fitzgerald, what he said to me, our staff said that primarily what they're dealing with is the catastrophic results associated with the wind and not the water this hurricane. So they are out working to perform various rescues and other humanitarian efforts there within Louisiana. And so to those individuals who deployed from here within Central Florida, involving multiple different agencies to their families, we know that that's a significant sacrifice for them while they are deployed. We believe that the 42 individuals who were deployed will be there for the next several weeks, a couple of weeks at least, and so we're going to keep them lifted up in our prayers as well. And so as we move forward today, let me just talk a little bit about really the need to help neighbors. And so since we've been in this state of emergency here in Orange County, it has been 168 days since we have been under a local activation. And we have focused on trying to make certain that we are good neighbors here within our county and taking care of one another. And I can tell you that wearing masks is very important to that effort to make sure that we take care of each other and stop the spread by wearing the mask. So I have to say thank you to our community as we continue to see a decline in the rate of the new positive coronavirus cases here within our community. Since the beginning of the pandemic, Orange County has had a total of 35,038 COVID-19 cases. We had an increase of 162 cases from yesterday that was reported today. Unfortunately, 369 Orange County residents have died from the coronavirus. Our cumulative positivity rate since the beginning of the pandemic is now 11.6%. Yesterday's positivity rate was 5.2%, and 5.6% is our average positivity rate over the past 2 weeks. So our numbers are clearly trending in the right direction. If you're like me, that's encouraging news. But I'm cautiously optimistic about where our numbers are today as we endeavor to open schools and universities, and we have now re-engaged with various sporting events here in our community. As we kind of learn to better live with the virus, we don't know what the future holds in that regard, but I know Dr. Pino is going to talk more today about the numbers itself. I have daily calls with our local hospitals, and they report seeing a decline in COVID-related visits to the emergency rooms, and admissions are down as well. That means that there's really still some work to be done here, though. So I'm going to continue to appeal to our community to follow the directives that we have put in place, which are aimed at keeping you safe. So please continue to abide by the face covering executive orders that are in place. Orange County Health Services will continue to offer free COVID testing at Barnett Park through tomorrow. We will announce the testing location very soon, and so stay tuned to our website at ocfl.net for additional information. As a reminder, the Barnett Park location is a pedestrian-friendly location, and which means that you can walk up to be tested, or you can ride your bicycle up, or you can drive up as well in your automobiles. Children ages 12 and up can be tested at this site with parent or guardian permission. The state regional drive-through testing site at the Orange County Convention Center is doing testing also for children. At that site, children 5 and up can be tested. Other sites around the county, we see a partnership with Walmart, with their neighborhood Walmart pharmacies in Orange County. There's drive-through testing at several of those locations. These are test sites that have been set up in partnership with the U.S. Department of Health and Human Services and Quest Diagnostics. For information on those sites, you can go to ocfl.net/COVID-19 for a list of the free testing sites throughout the county. Besides our health concerns for Orange County, we also focus on our social services for our residents here. Orange County's $20 million COVID-19 eviction diversion program had a successful kickoff this past Tuesday with the online applications as they opened. As of noon today, we had 1,223 tenant pre-screen submissions, and the landlords are in the process of being contacted for those 1,200 plus tenants. Then, of course, this is a two-way street. Landlords and our tenants can actually go on the site. And we have seen some 364 landlords submit applications, and so we're well into the process of coordinating and facilitating those efforts. We hope to avoid between 5,000 and 8,000 evictions through our $20 million program. Let me just say thank you to the Orange County Bar and the Orange County Legal Aid and the Mid-Florida Community Legal Services and others for helping with the process that so far has proven to be a smooth process. Our 311 and social media channels received more than 900 inquiries about our eviction diversion program. I'd like to remind everyone to review the program eligibility, and I'll very quickly go over that today. Both the landlord and tenant must agree to participate and meet eligibility requirements. Tenants must be in imminent danger of being served an eviction or potentially served an eviction notice. This program does not apply to those with mortgages, only those who pay rent. For those with mortgages, we say to you, you can go to ocfl.net/resident resources to learn about the Consumer Finance Protection Bureau that provides information to homeowners on how to request mortgage forbearance from lenders. You can call, again, our 311 line to get answers to questions about the eviction diversion program. As we move forward, I wanted to talk a little bit about some of our other assistance programs. Orange County was the first county in the region to offer crisis assistance for rent payments, utility payments, and other bills. We endeavored early on to use local dollars. About $1.8 million was set aside for that program, and we hope to assist as many as 1,500 households. I'm happy to report that as of today, $1,336,150 have been paid out. We had about $1.8 million allocated for that. So our goal was to assist as many as 1,500 different households, and we have now assisted some 1,200 plus. So that program has been going very well. The Orange County Cares program for individuals and families has processed applications totaling $25.9 million. This is to assist individuals and families in need. Our small business grant program has been doing well. 4,790 local small businesses of 100 or fewer employees have been assisted through that program with $10,000 grants, totaling $47.9 million. We had allocated $65 million for that program, and so again, as of today we have expended $47.9 million. In terms of our micro grants program for home-based businesses or sole proprietorships, 381 such businesses have been helped through this program with the average grant of $2,425. The maximum, again, for these home-based sole proprietorship types of businesses with 3 or fewer employees, they could get up to $3,000, and the average has been $2,425. So we have reached about 1/3 of those who we believe that we will be able to reach through that program. We believe that about 1,200 different home-based businesses would be able to benefit from the program, and so today 381 of them have been assisted. In terms of social service programs and other funding dollars, they are closely based upon and allocated by the federal government based upon our population. So I want to remind citizens about the need to complete the census data. As you all know, as a community, as a nation, the census deadline has been moved up to September 30th, so we're about 1 month away. And at this relative period of time, 10 years ago, 73% of the individuals had completed the surveys, and we're at 61% today. So we're slightly behind. So I am appealing to our residents to step up the pace in terms of completing the census data. The reason being so much of what we do is based upon having an accurate count from the dollars that we get allocated from the federal government, from the state, to how we design or draw the district boundaries for those various elected offices that we have. It is all based on census data. So we need our citizens' help to ensure that here in Orange County, we get our fair share of the dollars that we are due from the various governmental sources. And I've been asked by the Links, our local transit authority, to let you know that since March the 30th, individuals have been able to ride Links for free. There were no fares, but that is planned to change as of September the 1st. So just a few days from now, Links plans to return to charging fares for riding the Links buses here within the entire region. As you know, Links serves more than just Orange County, but it serves Orange, Osceola, and Seminole counties. And so for information about that, you can go to their website at GoLynx, that's GoLynx.com. And I'm going to wrap it up with that for now. We'll save other comments for afterwards. I'm going to go to Dr. Pino. I know he has a lot of information to share with you as well.
Thank you. Thank you, Mayor. Good afternoon, everyone. As the Mayor mentioned, we have 35,000 positive cases cumulative. And as yesterday, we received 110 positive test results with 2,954 negative results, and that gives us a 5.20 positivity rate for the day. We also have a recovery rate that continues to increase as 95% now, probably the highest we ever had it. And unfortunately, we have added since Monday 8 additional deaths and our condolences and sympathy with the families and friends of these individuals. The age range was 30 to 89. There were 2 female, 6 male, 2 black, 3 other, 3 white, 1 Hispanic, 5 non-Hispanic, and 2 unknown. 4 out of the 8 had pre-existing conditions that we know, and 4 we don't know yet from the data if they did have pre-existing conditions. And I also, just in general, just to let you know, all our data points are trending in the right direction, so I'm not going to go specifically into each of those because I want to give you some information about the schools. And with that, I also would like for everyone to follow us in Twitter at Go Healthy Orange. And if you guys from the press can announce that, we'll appreciate it, as we are going to start releasing data and graph in Twitter. With regard to the schools, as you know, our schools started face-to-face classroom and virtual learning on Friday. And we had a group of cases that has been tested positive. Before I say that, I want to establish the difference between quarantine and isolation, because those are 2 words that you are going to hear a lot from us when we talk about the schools. So isolation are individuals that are confirmed to be positive. And confirmed to be positive means that we have found a record of a positive test in our system that has been reported to the state, or we have a paper copy of a positive result. So that person is placed in isolation to prevent anyone else from getting infected. That's isolation. Then you have quarantine. Quarantine is an individual that you have not diagnosed, had not symptoms, but you make you believe that they were exposed. And then you quarantine those individuals for a period of time. Each depends on each disease. In this case, is 14 days. And quarantine comes from 40 days. And years past, a long time ago, when quarantine happened on boats, and it was during the plague, people would have to stay on the boat for 40 days. That's where the word quarantine comes from. But each disease may be a little bit different, the quarantine period. For COVID-19, quarantine is 14 days, and isolation is 10 days from the day of symptoms or from the day of testing, whatever happened first. Now, with that, we have 36 individuals that are confirmed cases and in isolation from the schools. Those are 21 students and 51 employees. Now, as far as we know today, there has not been secondary transmission in the schools. Secondary transmission is when someone that already have the disease pass it to another person, in this case, in the school system. Now, we are investigating a few cases to be sure that this has not happened, but we don't have evidence that this has happened yet in our school system. This means most of these cases were probably, most possibly, acquired in the community. Okay? So those schools are East River High School, Young Elementary School, Lakeview Middle School, Piedmont Lakes Middle School, and College Park Middle School. How we do this? So in the cases that we have a seating chart of the classroom, if we have a seating chart of the classroom, it's a lot easier for us, because then we will take everyone that is 6 feet or less from the patient that is, in this case, the student that may be positive, and then left side, front, and diagonal, we quarantine those students if we have the seating chart. And the teacher depends of the type of interaction. And again, risk is individual, and we explore risk in each situation. And I'm saying this because we may take decision in one classroom or one school that may be different from the decision that we take in another school. So people should know that all things are not going to be equal for each school. And then when we have the ability, we will try to be less disruptive as possible. But in one of the cases, we didn't have the chart for the seating arrangement in the classroom, so we quarantined the entire classroom. Because as much careful as we want to be, we are going to be really careful about preventing transmission. So we want to be the least disruptive possible, but with the more aggressive behavior that we can afford in these cases. Now, I got a text from my staff. I don't think that I did, but I'm going to repeat this again. 21 students, 15 employees. So with my accent, 51 and 15 can look a lot alike. It's 15. They asked me to repeat that again. And in quarantine, we have 117 individuals. That means 117 individuals that for some reason, in some time, were closer to individuals that were positive, but they don't have symptoms, and we don't have any test results on them. With that, it's also important that parents do not send to school children that are experiencing any symptoms of fever, coughing, shortness of breath, and it's always good to consult your pediatrician and inform the school before you send your kid back to school. If anyone at home was tested positive within 10 days, a kid should not go back to school. Should stay home even when the steps were taken at home to prevent transmission. With that, I will pass back to the mayor and will answer any questions that you may have.
All right, we'll respond to any questions. And for the Spanish-speaking media that's here, if you have any questions in Spanish, we do have Ms. Ilia Torres, who's here, who can translate for me, and we also have Dr. Pino, who is fluent.
Lauren Seabrook, Channel 9. My question's for Dr. Pino. I heard you say last night, you talked about how if we are able to kind of go on as other places have across the country, that we could likely see schools close in about 3 weeks. You also talked about the secondary transmission there. Can you explain that a little bit more for folks that are watching right now? And then also just talk about what is the process there once you've realized that one person has maybe passed it to one or two other students? Because I heard them say the school board would have to make the decision to close a school. So maybe just talk about that process.
So the schools are always closed by the board. We don't have authority, but we have the power of recommending and strongly suggesting what should be done. And we are working very close with the schools, and I don't see or foresee any difficulties making those decisions together. The board has been more than opening and welcoming us to make that type of decision. Now, there is a team at the health department that is entirely dedicated to the schools. That includes EPIs, tracers, and everyone else. So the way that things are happening, so we are triangulating data. We get data around 8 o'clock in the morning, sometimes even before 8 o'clock. That's the data that the state has received that is sent to us. That data, as much as we can between, let's say, 7:30 and 11 o'clock before they publish, we have the opportunity to clean the data a little bit. The things that are gross that you can see right away, there are things that require more time. And then in there's also a pediatric report, so we will know how many new cases we have. And in those searches, we can determine if this is a student, if it's a person in his school age, that's the first thing, determination. And second, the data will have which school they are going to in some cases. So with that, we also in communication with the schools, health services, and parents and teachers are also informing the schools of cases. So we get that triangulation. And in some cases, it could be that we are getting the information even before from the schools that we are getting it from the state. Because if that diagnosis happened in the morning after 7 o'clock the next day, So it will not be in the state data, but we will be getting that information from the school. And with that, we are also working with the principals and the teachers in case that they have a change charts to make determinations not only where the child will be sitting, but also the teacher's behavior. Is a teacher walker around the classroom? Was there the teacher keeping themselves at the front of the classroom? What age are the students? They were masked all the time. Were they in the hallways? Do they have a break and they go out to play in the playground? Did they have the mask on? So that type of interaction. And in some cases, some students, how long was the teacher with the student? How close were you to the student? So all those type of questions, all that is happening. But we are able to make a decision on quarantine right away and go into the details later, meaning to prevent any further spread of the virus, we quarantine right away, and then we can make those more fine-tuning decisions later during the day. So what I was talking about that, and I didn't know you were listening. I should assume that now. What we were talking about is that other counties and other sites on this country that have opened, by the third week, in the middle of the third week, fourth week, they have had to close the schools. And that goes with the transmission cycle of the virus. Now, we are working based on the CDC guidelines with regard to closing. The Board of Education do have those guidelines with them. And we are working with John and the superintendent and everyone else on establishing those decisions.
And I wanted to add also, we do have Mr. Scott Howard here from the school district. So if there are questions specific to the district, he can perhaps help as well.
Dr. Pino, Nadine with News 6, you had mentioned that you have a team of contract tracers just for the schools. Are these newly hired? You spoke a little bit about what they do, but really a little bit more on the contract tracing team. Is it one per school? And what about rapid testing for students? Is that coming anytime soon? I know the Medical Advisory Committee has been asking for that as well.
So with the rapid testing, we hope, and high hopes, that is coming pretty soon. Contract was with the state to be signed, and we even provide already the delivered address and everything that needs to happen. So we are just waiting. We are getting the machines, the readers, and we are getting 1,000 of those rapid tests. And we have the ability, for free, we are getting 1,000 on the machines. And then after that, we will be able to reorder those tests as needed. But I don't want anyone to have the impression that rapid testing itself is a solution to get out of this pandemic. It helps, and it will help a lot. But we will not be massively rapid testing schools and the entire system. It will be very surgical and direct where it needs to happen. This is a very reliable test. It's different than other rapid tests. It's actually very good. But we want to use those resources wisely and when needed. But yes, we hope we will have it next week.
Eric Sandoval with News 6. If we could bring Mr. Howard up, I do have a question about the process and the discussions that would go into the potential of shutting a school down, especially with these numbers of students and staff in isolation and in quarantine. Can you talk a little bit about that?
Well, we do have our processes in place, and of course we work very closely with Dr. Pino's staff in determining that. And they would ultimately give us a recommendation, and then we would take that back to the superintendent. The board would decide at that point as to whether a school was going to shut down, or even the superintendent deciding if a classroom would pivot to launch ed and stay at home versus being in school face-to-face.
Have any of those discussions already started with this outbreak?
Well, those discussions have been ongoing as part of our health and safety plan, but no,
there's no need. We are following basically an ecological model. So we go from the small to the biggest. And for example, let's say notification, which is, everyone that needs to be notified will be receiving a letter. that is sent by the Board of Education, but it's a document from us telling people, hey, you may have been exposed if you wanted to be tested, and what to do and what, what guidelines to follow. So if we have a student that is positive in a classroom, we only notify the classroom. If we think that the student may have exposed people outside the classroom, we notify the school. If we have to close a school, then we will notify the entire system. Hey, this school is closing. I don't have the paper in front of me, but a school closing goes, it's based on the number of positive people that you have, and to establish that transmission had happened. Not only by having a positive people in the school, but you also will take into consideration if you have symptomatic people. If a lot of fever and other things are happening in the school, and in this case, for example, to the question from Channel 6, that's a case where we deploy rapid testing. Before we made that type of determination and multiple people are having symptoms, well, we may test those people who are having symptoms with rapid testing to be able to make a quick determination. Okay, it's COVID-19, let's close the school. So that's the type of dynamics. It's very fluid. And again, each situation will require a different approach. And I want the community to be aware of that, because we are accustomed to, if A happens, we do B and C, and in this case, it may be a little bit different, and is that we want to be as surgical as possible, but at the same time aggressive. So that's the approach that we are planning to use.
This next question was texted for you, Dr. Pino, from Annie Martin from the Orlando Sentinel. Dr. Pino, have you seen any significant increase in COVID cases in the areas surrounding UCF's campus since students started moving back into the university housing earlier this month?
No. And I want to add a note on that. We also hired 10 volunteer students from UCF that will be trained in our staff, and they will help us within the school to do contact tracing. Because, schools and students, and especially in colleges, are very mobile, and this student will know how to find the others. So we hire as volunteer, and I want to thank them and the school for taking those steps to facilitate this process.
This next question for you, Dr. Pino, is texted from Ryan Gillespie with the Orlando Sentinel. Dr. Pino, what is your opinion on the new CDC guidelines for people without symptoms not to be tested?
I was hoping not to get that question, and I thought it would be coming from Lauren, but listen, the CDC offered guidelines and suggestions. The CDC doesn't have the capacity to enforce. Enforcement in public health comes from the state and the local level, and the counties mainly. With that to say, we do disagree with the announcement itself, but as a principle, we have not tested every single contact because, we go specifically, again, risk is personal. Our concern with the announcement is when you put in the middle of a pandemic this type of announcement out, the community may get a wrong sense of who needs to be tested and who doesn't need to be tested. So that's the concerning part. But we have done it. We have not tested every single contact. But we would like community-wise knowledge that contacts may need to be tested. And we highly suggest that people who were in contact with a positive person get tested, especially if it's 3, 4, 5 days after the contact, and especially if they have symptoms.
Dr. Pino, this next question was sent in from Natasha Chen with CNN. Dr. Pino, can you update us on whether or not there have been any outbreaks traced to any of the theme parks?
We keep getting those questions from everywhere. That's the same question that we get from the state all the time. And the answer is no. We have not been able to establish. This is not to say that we have seen a case here and a case over there that reference the parks. Like I was there last week, or I was there 3 weeks ago. But we are looking for it and we have not found it. It may have to do a lot. Well, the parks have taken great measures, and they have gone to great length to be able to, to open and to prevent the transmission. But it's also the whole thing of an open space, I think, is what making the difference. And also, the parks are not full. They are operating on probably less than 50% capacity, and that may be a contributing factor.
Thank you. These final two were texting for you, Mayor Demings. Ryan Lynch with the Orlando Business Journal. Mayor Demings, when will you expect the first of the eviction diversion funding to be paid out?
I guess we have a staff member here. I'm going to ask her to come up because she's been tracking it. There's a process. So my Chief of Staff, Roseanne Harrington.
Thank you, Mayor. So we have about 37 landlords and tenants that have matched, and they're in the process of completing their applications. The sooner they finish those applications, the sooner they move through. I mean, they could move through quickly if they they've already got their applications in by Tuesday, and if they're complete by Thursday, and the bar does their checklist, it's just a matter of us doing our final check and getting it to the comptroller's office for processing. I'd say on the shortest end, you're going to hold me to this. I'm going to say 3 weeks, and it could take up to 6 weeks if it takes time for the landlord and tenant to upload their documentation.
Thank you. And lastly, for you, Mayor Demings, this one comes from Scott Powers at Florida Politics. He writes, Osceola County filed its lawsuit today seeking to stop the proposed Split Oak Charter Amendment from going before Orange County voters. Do you intend to fight this suit? What do you think of Osceola County trying to stop an Orange County election?
We were notified, I believe, late yesterday that Osceola County had filed the lawsuit. And other than that, we'll be monitoring it. In that it's a lawsuit, we customarily don't talk about, the efforts that's underway. But so we're monitoring it going forward. So. Okay. Are there other questions? Okay. Thank you all for being here. And as always, if there's a need for one-on-ones, we certainly can accommodate that. Also, we have Commissioner Gomez-Cordero, who joined us today, and earlier we had Commissioner Christine Moore, who was here as well. So thank you all for joining us today.